Hello everyone and welcome to the MSC Performance Podcast. Today our fearless leader Mark is on his monthly holiday, so you are joined today by myself, Luke, and Sonia. Hello Sonia.
Hi everyone.
Okay.
Hi Luke.
Hello. So today we have a couple of questions that we're going to be running through that I think a lot of people will be interested in hearing. We're going to be talking about training for performance versus training for aesthetics. And then we're going to also talk a little bit about injury, which Sonia's going to talk through her experiences of managing injury, her personal injury, as well as her clients, and we'll go into a little bit of the information that we know and the best way to manage your training when we want to continue rather than just stopping altogether. But first, we're going to start off by talking about performance via aesthetics. So one of my clients asked me this in the week, and I thought it was a good topic to bring up, and I think a lot of people have the same idea. Do you find that when people are joining up for barbell club or coming for coaching, that they're maybe a little bit worried if they start training for performance that their aesthetics going to be compromised? Or
Yeah, pretty much. This happens very often, that like we either have people looking to gain strength or actually losing weight and looking better. Like that's the ultimate goal of most people, isn't it? Like I want to look good. I want to look good naked in bikini.
Absolutely.
So this is something we sometimes I think have to actually explain people, that these things kind of like either come across and very often it's the what is it, the stigma, or what they actually think is the thing and it's not. So a bit more explanation for you today from us will be, I think, good clarity. As you guys will probably find yourself with the same question, that you're thinking whatever is promoted, like in terms of rep ranges, if you don't follow someone's program or if you don't have any coaching, you're just probably following what's kind of like advertised as being the ultimate goal or the ultimate structure for strength, and then separately for performance, where actually these things have more in common than you think.
Absolutely. There's a lot of carryover from both, and they're definitely not mutually exclusive, like Sonia's just said. A lot of people think you have to train for strength or you can train for aesthetics. And I think what's really good now is we've seen like a new wave of people coming through that are a little bit more aesthetic. Because I think when people think about looking a certain way from pushing for strength or even weightlifting, in their head they're picturing a super heavyweight powerlifter or super heavyweight weightlifter or strongman. And everyone says, I don't want to quite look like Zuvila Sidrikas, which obviously is never going to be the case. But that's what people think, that they have to compromise what they look like to be a certain strength. But what's nice now is that this new wave of people are coming through where they're training incredibly well. They're training for performance, so either weightlifting, powerlifting, strongman, or team sports, and they're looking good doing it. And I think, like you said, the stigma is slowly changing.
Yeah. What I often found in MSC is that people come in with the aim to lose weight, look good, but actually they slide into understanding the strength and the performance. And when you ask them later, they actually just want to be strong and stronger, because they start improving the other qualities, and they potentially got into powerlifting as a competition, Olympic lifts, and they not even that bothered, because essentially if you don't want to compete like doing bodybuilding, you understand that that's not really the case of like, because obviously bodybuilders look great, right? But it's not really natural, is it? So
what it does take to become a competitive powerlifter is a hell of a lot of sacrifice. That if you do bodybuilding, powerlifting does not take that much sacrifice compared. Being a bodybuilder takes a lot of sacrifice, both in terms of like the amount of social stuff that you will do. You can't go out to eat, you can't go out to drink. I hear stories of a couple of friends that did competitions where they would like to see someone in a bar and have to ignore them and just walk past because they just don't want to stop. They don't want to even have like anything that's not water. It's super, super tough. And it's similar to weight loss, where like it's diminishing returns, and the harder that you push in the diet and the closer it's getting towards the final point, it becomes a lot harder to lose that little bit of weight, and you have to sacrifice an absolute lot to get there. So yeah, for bodybuilding, like when you're taking it that extreme, it gets very difficult. For most people that are looking to be just a bit more aesthetic than training pretty much exclusively for strength or for a certain kind of performance, is going to lead them to their aesthetics goals that they want as well. Where do you think this belief comes from? So apart from like the looks that we know for like powerlifters and weightlifters, the super heavyweights, which aren't quite desirable for a lot of people. Where do you think kind of this stigma comes from?
So I think that now you have so much stuff available out there, like obviously on internet and social media. And I think many like athletes, I don't want to call them athletes, but people promote this stuff. So they share certain, patterns, which which is not necessarily true, but it's just, I don't know. I feel like it's just been released, like it's been coming out for so long, but I think now it's actually being more pushed on the side that it's actually not the way. So if we're talking, let's say, like if you think that doing high reps and low load is gonna lead to, you know, muscle growth, and looking a bit more leaner, this is kind of the stigma we're talking about, right?
Yeah.
And then doing maybe your 3 sets of 5 or 3 threes for strength, like keeping the load high and dropping the volume.
Yeah.
That's probably the stigma we're talking about, which I think you guys are very familiar with. But on the flip, we're actually going to talk about that if you manage the volume and load, you can be pretty much doing the same and achieve the desired results.
One of my favorite stories to tell is when I was working in a commercial gym. I was doing a bit of powerlifting, and a guy was running a course, a personal trainer course. I was like, oh, yeah, I see you doing some strength work, blah, blah, blah. I was like, yep. I was just like, oh, I do a bit of strength work too, but I'm not doing 5-5s, I'm doing 5x6 because I don't want to just get strong, I want to get bigger as well.
Wow.
And it was as if like it was these magic numbers that people think about where 1 to 5 is exclusively strength. If you're training these low repetitions, you're not going to gain any muscle mass. All of a sudden, the magic number, you switch to 6 reps, and all of a sudden you're gaining muscle. And that sounds absolutely stupid when I describe it like that, but this is what people think when they're doing these low repetition exercises. It's purely for strength. There's no muscle building qualities there. So people think that when I'm training for aesthetics, I should be doing sets of 15. When I'm training for strength, we know that strength's very linked to intensity, so you should be training above at least 80% for some of your work, which obviously you're not going to do that many reps with. So people think that is exclusively strength. And like Sonia said, there's a lot of good research looking at low load versus high load training. And when you equate for volume, or not even volume, when you equate for difficult repetitions, so repetitions over like 5 RPE, that you can gain as much muscle on either one, which is great to know, because it means that if you enjoy doing the high load training, that as long as you're doing sufficient amounts of volume, so you're going to have to do more sets if you're doing less reps, but you're going to get stronger, you're going to gain more muscle. But if you prefer doing the low load training, you like chasing the pump, then that is also going to get you as big.
That's exactly what I wanted to state, and you stressed it already, that maybe doing like sets, reps about like 10 to 15, when you're aiming for muscle gain, it's usually the last couple reps till failure, but you have to know what kind of percentage or RP you're working with, because then, you know, you might do, you know, 3 sets of 15, but, you know, if you haven't used the range, if you didn't go till the failure, you actually done like absolutely
I call
nothing.
That then junk reps. So if you're doing 15 and you don't actually take it to a decent RPE, like Sonia's just said, you've done 15 reps, they've done absolutely nothing for you. You've got no stimulus, you've got no stress. So as a result, you get no adaptation. So you need to make sure that regardless if you're doing high load or low load, you need to be working to some sort of RPE that's recognizable. And if you finish a set of 15 and you could do another 5 or 10,
you didn't even touch that stimulus, the adaptation is not going to occur because you didn't get nowhere near to that potential, basically.
Absolutely.
So yeah,
I think from like, if you're training with a bit of focus on strength or on power, you know, I think one of the things, another one gets misconstrued is that people think you have to do just one or the other. So one thing that a lot of powerlifters are known for is skipping the accessories, and it's almost a joke. But if you wanted to be a power builder, which is what people talk about, where I also want to look good, which is just not a thing. What power building is powerlifting training done properly. It's doing your strength training and then doing your accessories and pushing them hard. And like you've just said, to the RPs that you meant to. And if you watch powerlifters train, not just powerlifters, weightlifters, anyone training, they'll do like their main meat and potatoes work. So it might be heavy squats for like sets of 5, 6 to 7 RPE. They'll go into the hamstring curl machine. They'll go into the leg press. I don't see many people get into a true 6 or 7 on the leg press. It is hard. So these rep schemes don't have to be exclusive. So power building is not a thing. You can do your hairy strength work, and then you can do some high repetition work. Get that kind of sensation that people want when they're thinking of aesthetics. And yeah, that's another thing really to
probably think about. A big shout would be to nutrition, just not to make confusion. Like if you want to train purely for aesthetics, you probably, obviously, everything we said is really important to keep in, you know, the volume and managing the selection of exercises, but it's probably going to be your biggest card to play with if it's purely for aesthetics. You get my point here.
Absolutely. So I think what you're trying to say is when you're training for aesthetics, it's similar to what we said about bodybuilding. At some point, you're in a calorie deficit and probably a hard calorie deficit, and you're probably low carb, and they're not optimal for strength training. So there's a point where kind of if you want to be the best powerlifter or you want to be the best bodybuilder, you probably have to sacrifice one or the other.
Yeah.
For the majority, 95% of people that aren't going to compete, 99% of people that aren't going to compete in bodybuilding, you won't have to drop your calorie deficit that much. We always talk about trying to do things fairly slow and sustainable so that we can like maintain as much muscle mass as we can. Yeah. So, but if you're like thinking about getting to stage lean, at some point you should still be training hard. You should still be training like big movements, but you're going to have to sacrifice a little bit of strength.
All the coaches kind of train for performance, but we all look pretty decent. So.
Like, yeah, if you look at Mark trains exclusively for rugby. He's not obsessed with his aesthetic. I mean, he does arms 4 times a week, so Mark's a bit of an outlier.
He loves his uppers.
Yeah. But absolutely, like you said, like we all follow like strict nutrition. We all train exclusively for performance. But as a secondary to that is the aesthetics. And that's kind of what we're saying, is that you can push the performance space, which we find to be a lot more sustainable for people. When you have some kind of number-orientated goal, people seem to be a bit more engaged in their training. You can have that and still have the outcome of better aesthetics.
I think this kind of nicely overlays or relate to the accessory work being related to the injury prevention as well. So that's why you just don't want to do your hamstring curl, like, you know, just for the sake of it, do your 3 sets of 10 or 12 or 8 or whatever it is.
If you're not registered in an RP at your hamstring, any hamstring work, you're pushing your anterior dominant or quad dominant work super hard, and then the hamstring work's just not getting any stimulus. And in terms of robustness and injury prevention, like Sonia said, it's not going to be doing enough. So from an injury perspective, which we're going to come to in a second, you need to make sure you're pushing your accessories hard. But for that overall kind of aesthetic, I think the takeaway point is that the low load and high loads aren't exclusive. You can do them both in a training block. Both of them will lead to similar muscle mass, but you have to train hard. And I think that's the mistake people make when they're training purely for strength. They almost see it as an excuse not to train hard on their accessory stuff. So we need to make sure we're working hard on everything that you do. You're in the gym for 90 minutes, like work as hard as you can within the constraints of your program. So if your program's hamstring curl at 6 RP, take it to 6 RP, but that's enough stimulus then to get it. People say 6 RP and they think, oh, that's super easy. I'm hardly going to try. And
they're actually not training at 6 RP.
They're training at like probably a 0 RP. You could probably get another 10 reps.
Maybe this would be a good question. Like, where would you then bring for someone 2 sets of 10 or 3 sets of 5? Where would you draw the line? Like, would it be my choice that I enjoy higher rep range, or I would tell you that I just prefer to do a bit less reps?
If you came as good question. If you came and said that you don't particularly like doing high load training, or you find that doing higher intensity stuff causes any issues, or you just don't like doing it, it's that dose relationship again. So I think you should still be doing some, but if you hate high load training, your high load is going to be very different to my high load. So it might be like a set of 5 at 80%, and then the rest of your work could be like 70% for sets of 8 to 10 repetitions. You should probably still get that little bit of a dosage in, just to still get that like strength and power stimulus. But it doesn't. It's very individualized there. I think people should be doing a combination of both.
Yeah, because I would say from my perspective, it also depends on the exercise. Because I came across a program where I was supposed to do like 20 to 25 reps on bench. So that's something I wouldn't personally do myself, or let's say I wouldn't give someone super high rep range on a deadlift.
The problem, we have exercises that we talk about that are strength friendly, which are a bit more skill based. And then we have hypertrophy friendly exercises, and hypertrophy friendly exercises are ones that are less prone to technical breakdown. So a bench press, I mean, you're a good bench presser, but a complete beginner, well, you're okay. A complete beginner on a bench press doing 20 reps, all of a sudden he makes a mistake. He's going off his throat. He's pressing it badly. He's getting himself into a position where he could be injured. So we like to do like strength orientated exercises like squat. And then if we wanted a bit more hypertrophy focus, we could follow that up with a leg press, with a belt squat. More safe, easier skill. Just you don't have to worry about your technique. You just push them as hard as you can. So absolutely right. So you have exercises that are more strength orientated, your deadlifts, your squats, your Olympic lifts, and then you have exercises that lend themselves better to to low load, high repetition.
Good shout for the Olympic lifts. So like workouts like max snatches in 3 minutes or whatever the time is. Ridiculous, in my opinion. No. In my opinion, it's ridiculous. Depends on your skill level. Okay, if we're talking about people like myself or Matt Fraser, someone who's like really, really drilling their technique and they know what they're doing and they have all the background and the strength base, fine, probably what you're doing. But to give someone perform like a high skill movement in like not controlled manner and possibly loading it up, that just sounds, and just ask for risk basically. So that was a good chat actually.
That's one of the things that MSC prides itself on, is like when we're doing our Metacon sessions, rather than doing like the Olympic lift for high repetitions, we're doing a sledge sprint. You're still getting good output, but there's no, even if someone got into a bad position on a prowler sprint, like their injury risk is so low compared to
or instead of barbell using dumbbell, kettlebell.
Absolutely. Yeah. So I think this is a good chance to wrap it up. So the takeaways are that the aesthetics and the sports don't have to be mutually exclusive. You can train low load and high loads, and as long as you equate for volume, you'll get equal muscle building. We believe that you should have a combination of both in your program. So there's exercises like we just touched on that lend themselves better to high load, and there's exercises that lend themselves better to repetition. The key is just to train hard. Make sure you're pushing all of your stuff, not just your main movements or not just your accessories. Make sure you're pushing everything hard to the RPs that are set in your program, which if you're looking for a hypertrophy stimulus, a minimum of 5 RPE. People used to say 7 RPE. Now I think you can go as low as a legit 5 RPE. And yeah, you look at the best bodybuilders, they're doing strength training, and you look at the best powerlifters and weightlifters, and they're doing hard accessory work. They're not mutually exclusive. You need to train hard, you need to push things, and you can too get that aesthetic, powerful look similar to myself.
Good job.
Fantastic.
Take it all, you get it.
Moving on to our second question, which I think you're going to lead.
Okay.
Talking
Injuries.
a bit about your...
Yeah, a little bit from experience. Obviously, I think when someone injured, like it teaches you a lesson, like yourself. We work with people who come across and they are injured or have some sort of issue, so we're working around. And I found myself that like it's a bit different, or it used to be different when I didn't have an injury. Like this is a touch wood, but I was very low on injury rate. So I never really had an injury which would limit me or stop me. So I was always up for anything. And I was lucky to have like almost ability to perform anything. So, I would do my session and I would maybe jump on into your Metcon and I would be completely fine with it. Obviously I had the injury. Do you
want to talk about the injury?
Yeah, a little bit. So just a little bit, just to explain. So I had like a minor fraction in my back, which obviously changed my whole training a lot. So if you know me, you know that I was doing Olympic weightlifting, and probably lately you didn't see me doing much of it because this current stages doesn't allow me, or I'm just being a bit more sensible.
The ultimate goal for you is to get back to Olympic lifting.
Exactly.
But you've got this progressive plan in place.
Yeah.
And before we get stuck into the injury stuff, you're getting guidance from Max, who's the sports injury clinic here. I think it's massively, like little muscular injuries you can work around themselves with the advice we're going to give you to now, but don't be afraid to reach out to someone who's a professional to get good advice and to get a program that's going to be progressive to get you back in. What we don't want to do is stop altogether, which is what Sonia's just saying. We want to train around the injury as best as we can, but we're getting help and guidance to make sure that
probably general advice if you see a doctor is probably take rest or stop training, which is something what we wouldn't do, and we wouldn't even recommend it. And yes, as you said, see a professional. Even though we are coaches, I would still seek for someone who knows better in that area, so I can adjust the training appropriately and doing the right thing, which is something everyone should always do.
It's about not being so proud to not ask for advice. And you're not too proud to ask for advice.
Definitely.
Everyone's got their area of expertise and you should absolutely reach out. The second thing I want to touch on quickly is don't be put off by the chat we're having today about injuries, because the injury rate in strength, weightlifting, powerlifting, strongman, even Highland Games, the injury rate is so low comparatively to team sports. So injuries do occur in all sports. Whenever you're pushing training hard, there is that risk of injury. But the injury rates in strength sports is super low. Like Sonia's just saying, she's been weightlifting probably for 5 years, maybe even more. And this is probably 7 years, and this is her first, main injury. You compare that to like basketball, everyone's injured every other week.
Especially contact sport, yeah.
Exactly. Any sport where there's change of direction, the injury rates are super high. So please don't be put up on what we said today, but we're just giving you advice for when it inevitably happens at some point in your training career. So yeah, the first thing is reach out to someone who is a professional that can give you good guidance, and avoid stopping training altogether, because that's the last thing.
So obviously, if you can't do the thing you ultimately want to do, which in my case would be doing two lifts, such as like snatch and clean and jerk, you just build on and working on the other qualities, which ultimately will then lead to a safe introduction when you start introducing the lift. So all around training, keeping your squats, keeping your knee dominant work, your hinges.
And for yourself, your squats started to look a bit different as well, didn't they? So probably back squat wasn't an option at the time. So you
reached out for the belt squat.
Belt squat, reduced the loading through the back. Hatfield squat was the next one.
Yeah. So reduce the spinal compression basically.
And these aren't regressions. These are exercises that are just optimal for the current time. So it's not like the belt squat was a massive regression for Sonia. It's a hard exercise. Again, when she's pushing it properly, it's enough to keep a good stimulus for both hypertrophy and strength. Yeah.
So that was for the squat, let's say, and then obviously let's say I stick to trap bar, just a bit less demand on the back for that. So I kind of completely get rid of conventional type of deadlift or clean pulls. What was it like in the back? Hyperextension. So I was trying to do everything kind of like flexion, and then you slowly obviously building up the load in those positions, and then you slowly start introducing those positions which were difficult. So for the sake of weightlifting, I wouldn't just go straight away for something like a hang snatch, which is quite rapid. So it was like a slow snatch balance, slow overhead squat, a lot of eccentric tempo work. So obviously that way you can load up or increase the tension. So you don't necessarily have to be using heavy load, but the tempo and the tension kind of supplements that. So that was a good start with eccentric work, and it's still in my training now. It's a long process, gets very frustrated, especially when you see.
I think it's important to say that it's not perfectly linear, is it? Like,
no.
You're training, everything's projected in the right direction, but there's little step backs that are going to happen on the way. But it's important not to get super frustrated when these little step backs happen. I think there's little bumps, but
the issue is that when you get a little better, or you feel like it's almost there, you have to keep in mind that you just can't just suddenly go back to where you were before. Like if you were squatting, 130, it's just not going to happen. Yeah.
I think what you're saying is the main point when I talk about today is training around the injured area. So choose an exercise that don't cause any more aggravation, allowing the injury to actually recover, but then finding a good entry point for said injured area. So you were still doing back dominant work, but you were finding something that was suitable for the current climate. You wasn't doing super hard deadlifts, you were doing hyperextension, still training the musculature, but in a way that's not causing aggravation.
I would say that during that period, you're not really looking to get stronger, but potentially maintain what you've got and improve the qualities, which will then enhance, like, as you said, like not irritating the injury. So in my case, if it was the back, so I was making sure that like my trunk is super strong. So loads of like isometric work, side planking, basically all the stuff people kind of neglect. But yeah, thanks to Max and his advice, I just felt, and I know I was on the right path, which was way easier for me to follow than coming into a gym and doing things which, you might leave a bit sore. You don't really know what's going on. So, let's say Max said zero pain, like no irritation. So if you leave a gym, you train and you don't feel any pain, you're doing the right thing.
I think one thing I want to actually maybe question from what you just said, because I actually might disagree, or you might you might have maybe said it slightly. I didn't understand it. I think you can actually get stronger while you're injured in different areas. So if okay. So maybe that was I just said it wrong. Not like necessarily getting stronger, but you're not going to get stronger at your weightlifting. There's other areas.
Yeah, that's what I meant. So absolutely. I know that I won't just then go back and PB my snatch, but I actually know that I won't lose it. So when I get back, I know at any point I'll be comfortable to do a bet above 80%.
So for yourself, like you're not doing your snatch, so Your snatch is you're not going to PB snatching the next month. However, like your bench press, your static strength and other lifts have really progressed on. So it's a great opportunity to train on other things that you might have neglected in the past or not pushed quite as hard. So she's completely changed her.
Glad that you picked up on it, because that would be misunderstanding. Yes, so obviously your main lift wouldn't just go that high, but it doesn't mean that the other things, the other qualities can improve. Definitely, yes. Definitely still can get a good squat, good deadlift. And as you said, like I've changed to different things, so I was focusing on those.
And like for yourself, when you talked about the high load v low load, some people might find like high volumes of training cause irritation. Other people, it's high load. For yourself, it was high load. From what I understand, doing heavy stuff was causing aggravation. So you've put a lot more focus onto like capacity work. So low load training, more conditioning based work, lots of volume. And for other people, it might be the other way around. So they might find that like, for a lot of people, stuff like the QL or like the lower back just gets really sore after lots of volumes of squat. And that might be the case that you reduce your volume down for a while, continue with the high load training, and then progressively build your volume back up again as your capacity increases. So these are going to look very different. This is a good kind of story to go through because it's very relatable, but there are going to be very different individual differences. For myself, my last injury was the adductor. That was kind of last year. For myself, and similar to what Sonia said, I was guarding the adductor by doing like closer stance squat work. So still trying to maintain and do the squat and the deadlift, etc., as best as I could. And then trying to find a good entry point, like we spoke about earlier, for the adductor. So for example, like slightly wider squats with like a goblet, so low load training and just getting back into that range of motion and just starting to build up that stress in that position, which is what was causing me aggravation. But I was still trying to train around the area as best as I could. But the entry point to build up the adductor strength and to make sure that like there's no kind of long-term issues that are going to happen. Because if you stop altogether, like the scar tissue that can be caused from a muscle strain can really change everything and become a long-lasting injury if you don't continue to train.
Yes, there definitely still should be some sort of stress for that area, but kind of different type of stress. So if I still want to squat, I'm going to use something which will allow me to get the knee dominant work in, but not going to maybe use the spinal loading as much.
Exactly. So for myself, like I said, close stance, and then I was doing like a 12 kilo kettlebell for a wider stance goblet.
So finding the variation which works and which doesn't, and then slowly returning back to the original movement you're actually looking for, but it's just all gradual. And like there's not really a time slot for it. I would say it's just kind of like trial and error, seeing how things progress over the weeks.
It's very individual based off the severity of the injury, isn't it? So for yourself, yours was a fraction. It was quite serious. You compare that to a grade 1 muscle strain, that might be 2 weeks. It might be 2 weeks of guard in the area. In that case, there's going to be very minimum strength loss. If it becomes months, or if it's like a grade 3 tear like off the bone, it could be like surgery, and then that's going to be a massive timeline. So it's important to try and get a diagnosis and know what you're working with, and then you can kind of have a rough timeline. But I think the thing to be good about it is to be reactive to things that happen, rather than just saying I'm definitely going to do this. It's be reactive. So if you're been doing belt squat, like you said, and you go to a Hatfield squat as the next progression in the system, and it's still a little bit uncomfortable, rather than just saying I'm going to continue with it, it's knowing when to push it and when to ease back, and listening to your body of when and where you should be going.
I think a good shout would be distinguishing between injury, pain, and being sore, because very often happens when people just, from doing nothing kind of come and start doing a bit, they feel more sore than usual, and they often relate to it as a pain. So, you don't necessarily have to see a physio straight away or panic or avoid full squatting or skipping a gym.
The big one is the lower back soreness that people get from deadlifting and squat. And again, distinguishing, when we say soreness, we're talking muscular soreness. There's loads of muscles in the lower back that are working hard that people never do. And nothing creates soreness like novel stimulus. So if you've not deadlifted for months and then you come in and do even like 2 sets of light trap bar, it's super novel, it's going to cause discomfort, and people really get worried by that.
I know.
It's distinguishing between the muscle soreness, which will be gone in 48, maybe 3 days max, compared to like something that's going to cause issues for weeks.
How often do you feel sore after the deadlift session?
I feel a little bit sore, but like not bad sore. However, I've just had a I obviously had the competition last week, so training for that was dropping down a lot, and then I had a week off where I trained twice. So I trained on Monday, and I'm still sore.
Yeah.
But again, it's because the novelty of having the break.
The soreness,
exactly.
and you're not panicking because you're a bit sore, because obviously the experience comes with training experience. So probably like a takeaway of the injury section would be that don't be scared to reach for help, no matter what your knowledge is. Like coaches need coaches. That's probably the number one. And then second thing is find a way how to train around it. There's always a way how to train around it, mostly, I believe.
I think always, even if it was like a super severe lower body, you could train. Remember Mark tore his bicep?
Yeah.
He came in the day after and he was doing sledge drags with his hand in a cast. Luke Richardson's tore his bicep, he's doing safety bar squat.
Yeah.
You might not be able to train everything, but you can train
definitely.
something.
Sometimes you probably have to change things like more. Like let's say I went from Ollie to completely different type of training, but it's still training, and I know it's gonna eventually like prolapse into the training. So it's fine. You just gotta do what's gonna be done.
So train around it and then find a good entry point. So for you, was finding exercises that were suitable for the lower back, that strengthen the back again, build back up the capacity of your back without causing any further aggravation. So it's allowing it to recover, but still giving it that little bit of work and that little bit of dosage that's going to help keep it strong. And like we said, takeaways, don't be worried about getting injured, because the injury rate is super low of strength sports, and it's something like, I think it's 7 injuries in 1,000 hours. So it's very, very low, evidently from Sonia that's trained for 7 years. And for myself, I've been injured 2 or 3 times.
Yeah.
So.
And I just want to say one thing. I remember you actually said to me at the beginning when I talked to you, you said everyone who trains gets injured. Yeah. So
when anyone trains hard enough, they are going to get injured.
That was it, yeah. And that really stick into my mind. Like, you
look at any sport and the top guys are getting injured because training that hard, you put yourself in a position where there's a little bit of risk to getting injured, and that's not necessarily a bad thing. It is what it is. I guess if you're a general population, like the bodybuilder style training is the lowest injury rate as of anything that's ever been researched. I think it's like 0.7 injuries. It's super, super low because the majority of them don't do the heavy kind of stuff. The low load is a lot easier to
often using the machines, so that's probably keeping it safer as well.
Exactly.
Lovely.
Fantastic. So hopefully you had some good takeaways on training for performance and aesthetics, and then also a bit of an understanding about training through and around injuries. So I guess to finish up with, just a little bit of update on MSC. As most people will be aware, Ben has now left, so we wish Ben the best of luck with everything moving forward. As a result, we have the Metcon Games coming up in 2 weeks. The teams have been announced.
Things have been announced. Events been released. So everyone's we're hoping everyone's kind of preparing. We've seen.
What are the events?
Do you want me to talk through? No. I just wanted to say that we obviously allocated like a team captain of the team, and we just so far have seen a lovely team spirit. People are getting nicely together, and we're all just very excited for the hype week as we're gonna have the barbell testing, followed by the Metcon Games and a little bit of social. So it's gonna be super nice to get together. This is probably what's going on at MSC at the moment. Everyone's preparing for the games.
Everyone's preparing for testing. And then on the powerlifting side of things, everyone's just finished the competitions. Well, 8 of us have finished competitions. So it's back to the off-season training, working on what needs addressed, build a bit of capacity, just some high repetition work for the majority of people, or develop some skill. It's an exciting time, and the buzz is good. So if you are interested in joining an MSC Performance, you can drop us a message through Instagram or any of the socials / the website, and we'd love to have you down. So
fantastic.
I think that's a good wrap, guys. Until next time, speak to you soon.